Hello everyone, my name is Edgar Hernandez, and today I'm going to be talking about NEMO technique. So what is NEMO and where does the word come from? The name NEMO comes from its founder, Raymond Nemo, who was a DC that graduated from Palmer School in 1931. However, the curriculum for the certified NEMO care was designed by Dr. Jeffrey Cohen, who was certified as a NEMO care instructor in 1978 by Dr. Raymond Nemo himself. NEMO is also known as receptor tonus technique, which is a non-invasive pain relief treatment that is based on trigger point muscle therapy. Receptor tonus technique is a systematic approach which uses ischemic compression to remove myofascial trigger points. The whole goal of this technique is to eliminate the cause of pain, promoting healing and preventing recurrence. Indications for NEMO technique involve first visiting a doctor who will search for these trigger points and figure out a method to correct these trigger points using the NEMO technique. Trigger points arise from acute or chronic muscular overload, trauma, and poor posture. So this can literally happen out of anything. Trigger points are hyperirritable spots commonly found in skeletal muscle associated with palpable nodules found in bands of tissues. Trigger points are always palpable by the doctor. Trigger point therapy allows for restoration of normal muscle tone and flexibility, which means your muscles will probably get back in track to the way they were working before. NEMO treatment involves very specific pressure to the identified trigger points, usually about 5 to 7 seconds per trigger point. Multiple repetitions allow the muscle to relax and acquire its normal length and relaxation tone. However, the amount of force used is dependent on patient tolerance, meaning that if you're applying little to low force and the patient complains, you have to understand that that is the patient's tolerance. Specific pressure creates relief from pain and also prevents future injury. So what is the difference between trigger points versus tender points, you may ask? Well, trigger points are associated with myofascial pain that occurs in areas of muscles that are painful to palpation and are characterized by the presence of taut bands. So usually when a doctor is searching for trigger points, the patients will let the doctor know that there is pain in that area. However, tender points are associated with fibromyalgia pain, which is non-palpable when examined and is commonly characterized as muscle soreness. So this is the pain we feel after working out. You feel very sore. These are tender points. However, if you feel that it's a specific point where you can clearly feel like a lump and palpate that inflammation of the taut bands, then that will be considered a trigger point. Now for a video demonstration, I would like to introduce the one and only John Gibbons.
Now, what we're going to use is a wax from Songbird. What we do, we just rub 1 or 2 fingers across and we just apply that along the spine of the scapula here and then just above it into the supraspinous fossa. So we don't need much. So I tend to put them under my own umbrella and I normally call them the Body Master Method fascial techniques. I tend to use 1 finger over the other like this, so I reinforce it. I don't tend to use thumbs ever. And I'm going to get my patient to slowly lower their arm down. And if I feel she's going too quick, I can stop. I can come back up. And then we can use a breath in, breathe in. And as they breathe out, they can lower the arm down. So I'm gliding through the supraspinous fossa here. But if they adduct, it tells the abductor to relax. So it's almost like an inhibition technique. So the thing is take a breath in, get the patient to slowly push their arm down. So now it's inhibited and now I can glide through the tissue as my patient is pushing the arm down. And that technique works very well because I can glide as she's adducting, and that works really well. If I get my patient to reach forward on their own, okay, so if I get them, look at my fingers, 3 fingers, I can reinforce if I want to. If I get my patient just to glide forward, so this is active motion by the patient. Okay, one would call this maybe like an STR, like a soft tissue release. I like to assist and control. So if I do the movement, it would be now a passive release technique. Okay, rather than the patient actively bringing her arm across. So now she's working actively as I'm, slowly, as I'm gliding through. I like to do it passive because I control the speed, like a trigger point treatment. And I can glide through like this. Just do it until you feel there's a change to the tissue. Okay, but please don't over-treat, because you might find that you irritate and you actually bruise the tissue. So be careful when applying these techniques. And that works really well.